Everyone, today we are going to discuss 10 topics. So first is your diagnosing lymphoproliferative disorders. A patient presents with monoclonal spikes in both serum and urine. The presentation is a hallmark of multiple myeloma, a malignancy defined by the overproduction of monoclonal immunoglobulins M spikes by a malignant clone of plasma cells. While other disorders like lymphoma or Hodgkin's involve lymphocytes, they rarely produce concurrent serum and urine monoclonal spikes. Proteinuria and Benz-Jones proteins. Multiple myeloma cells secrete complete immunoglobulins and or free light chains. Diagnostic markers in serum is M spikes detected via protein electrophoresis. In urine, excess light chains known as Benz-Jones proteins pass through the kidneys and are detected in the urine. Burkitt's lymphoma versus multiple myeloma. Unlike the systemic protein secretion of myeloma, Burkitt's lymphoma is highly aggressive and usually presents as rapidly growing masses in the jaw or abdomen. The CMVC translocation and Epstein-Barr virus link for Burkitt's lymphoma is important. For multiple myeloma, the CRAB acronym explains the systemic symptoms. Where calcium, C stands for calcium, bone lysis, as multiple myeloma stimulates osteoblasts to secrete rankle, which activates osteoclasts and leading to lysis of the bone and increased calcium in the blood, leading to hypercalcemia. R stands for renal, kidney failure. Clones flood blood with toxic M protein light chain which filter into the kidneys and form hard plugs, causing cast nephropathy. A stands for anemia, marrow crowding. Sheer volume of tumor cells crowd out the normal cells, so which causes drop in the red blood cells and functional antibodies. B stands for bone, direct structural destruction from the lytic lesions. Next topic is the identification of typhoid ulcers. A specimen showing large ovoid ulcer oriented along the long axis of the intestine. This is characteristic of typhoid, which targets Peyer's patches in the terminal ileum. How to differentiate between other ulcerative lesions? In intestinal tuberculosis, the ulcers are transverse, girdle-like, because the infection follows the circumferential lymphatics. Crohn's disease, you must look for cobblestone appearances in serpentine ulcers. Ulcerative colitis usually involves continuous superficial inflammation in the colon. In the gross pathology of typhoid, point out the longitudinal orientation of the oval ulcers, which you can see over here. These are longitudinal ulcers and with relation to the long axis. So ulcer orientations in tuberculosis is parallel to the long axis, whereas in tuberculosis you can see that they are horizontal or perpendicular to the long axis. Morphological features of intestinal tuberculosis. The TB ulcers often have ragged, undermined edges and a thickened floor. Healing is by fibrosis, which can lead to intestinal strictures. Now the next topic is metabolic bone disease, osteomalacia. Osteomalacia is a disorder of mineralization, not matrix production. That means the body produces normal bone matrix, which are the osteoid, but it doesn't calcify owing to the vitamin D deficiency. As a result, unmineralized osteoid seams on bone trabeculae are formed and the bone becomes soft, leading to aching and deformities. The next topic is a visual representation of an anatomical structure after thyroid surgery. So thyroid lobes are mobilized, exposing the cartilaginous rings of the trachea in the center of the wound bed. Note the recurrent laryngeal nerve running in the tracheoesophageal groove. This is a critical structure that surgeons must carefully isolate and preserve. Now understanding the ear cuff reflex, that's called as Arnold's reflex. Mechanical stimulation of the deep posterior inferior ear canal wall triggers a cuff. The nerve involved is auricular branch of the vagus nerve, which is cranial nerve 10. Nerve distribution in the ear. Trigeminal nerve V3 branch supplies the anterior and superior canal. Stimulation can cause referred jaw pain but not a cuff. Facial nerve, which is cranial nerve 7, minor sensory role in the canal. Vestibulocochlear, which is cranial nerve 8, it's purely for the hearing and balance, no somatosensory input to the ear canal. Now coming on to the neurology or the motor nerve lesions. A lesion at or distal to the nucleus in lower motor nerve, example Bell's palsy, causes complete paralysis of the entire ipsilateral, which is the same side of the face, affects both the forehead and the lower face, whereas the supranuclear upper motor neuron facial nerve lesion result a lesion above the nucleus, spares the forehead due to bilateral innervation, causes paralysis only in the contralateral lower portion of the face. Now coming to the question pertaining to the high malignant potential. Erythroplakia carries a 14 to 50% transformation rate, the highest among oral lesions. Biopsies often show severe dysplasia or carcinoma in situ at the first presentation. Oral submucous fibrosis in lichen planus. OSMF has a transformation rate of 2 to 8%, whereas oral lichen planus has a very low risk, 0.5 to 2%. While leukoplakia is more common, erythroplakia is significantly more dangerous. Now coming on to the gingival architecture. McCall festoon are rounded, lifesaver shaped enlargements of the marginal gingiva. most commonly on the facial structure surfaces of the canines and premolars. Differential diagnoses are Stillman cleft, V-shaped or slit-like indentations, but they are not rounded. Widow's peak, they are sharp pointed peaks of tissue between teeth. The mechanics of stability. The modified pen grasp is the tripod system with thumb placed directly on the instrument handle, index finger placed on the handle opposite the thumb, forming a distinct V shape, and the middle finger, the pad rests slightly on the shank of the instrument, differentiating it from a standard pen grasp. Mechanical advantage of the tripoding is a specific arrangement prevents twisting or slipping, maximizes tactile sensitivity, and provides superior stability when applying lateral pressure against a tooth surface. Coming on to the last topic, which is Wien's classification. 4 types. Type 1, 1 orifice, 1 canal, 1 foramen. Type 2, 2 orifices, 2 canals joining to 1 foramen. Type 3, 2 orifices, 2 canals, 2 separate foramina. And for type 4, 1 orifice splitting to 2 canals, 2 separate foramina. That's all for today.